Joining me now is Dr. Cristian Tomasetti from the Johns Hopkins School of Medicine and the Bloomberg School of Public Health. Welcome, Dr. Tomasetti. Let's start out with, we often, as I'm sure you do, go to a number of these different meetings. They tend to be siloed and focused very narrowly or relatively narrowly. What do you think is the value of something like this Vatican conference that brings together so many different disciplines?
Yeah, I think that we should definitely not do anything in silos. I think the most important research, in fact, is usually the one that creates connections among different fields. It's the ability to put together things that you I thought before. So I think conferences like this are really important. In my own research, I studied cancer, but there are many implications that are, not just relative to the body, but to our minds and to our souls or spirit, right? So there are dimensions when a person is diagnosed with cancer that is not affecting just the body of that person, obviously. And so it's very important to be able to discuss and to learn about all the sides.
You mentioned cancer. Let's talk a little bit about that. What role does behavior, the environment play with respect to cancer incidence and cancer prognosis?
It plays a major role. We know with incredibly important findings from the 70s and on that, for example, tobacco smoking has a huge impact on cancer. And tobacco is one example, but of course there are many others, like sunlight exposure when it's too much, or alcohol, or BMI, and of course there are also inherited factors like BRCA gene, so inherited mutations essentially. Okay, but yes, the environment plays this very large role. In my research, I think I discovered, or I presented some evidence in support of the idea that there is also another very relevant role for endogenous processes. So this means just internal processes that occur every time a cells divide. Basically, every time a cells divide, we estimate 3 to 6 mutations hit the DNA of that cell that's getting its DNA duplicated to give it to the $2 cells. And so what we discover is that actually this ends up playing a major role in cancer. We estimate that when you look at cancers and we sequence cancer samples, when you look at them, you may be able to attribute about 2/3 of all the mutations that you observe to this factor, which is just this random replicative mutations. I call it bad luck.
Bad luck indeed. After you're diagnosed, after you develop cancer, can you change the prognosis by changing your environment? You can't change your genetics, at least not yet. Can you do something to improve the prognosis at that point?
Well, there are certainly things that you can do to help. For example, physical activity and diet, and of course, following anything that the oncologist will tell the patient are all very important things. I think though a major role and really one of the most exciting future things happening now in cancer research is the ability to detect that cancer earlier. Because in general, the problem with cancer is that when it's detected late, in metastasis, that's when it becomes very difficult to save the patient.
Very exciting. And an exciting, would you say it's an exciting time to be working in cancer and cancer research?
Yes, I think especially this new technology is working on, simple blood tests that can detect multiple cancers at very early stages. I think that's fantastic, and it's exciting, and it's also, my opinion, coming relatively soon. We're not talking about 20 years from now.
Dr. Cristian Tomasetti, thank you. Thank you for your insight. We appreciate it.
Thank you, Dr. Gomez.